Accident from Odell, case number 36 it is. From the new Odell, I'm going to discuss this. So this case actually, again, is extremely relevant and important for ADC. How it is important? Because it highlights and it brings to light how you have to address a case of child abuse. And it does also, it talks about a little bit of pediatric traumatic injuries, which we will utilize this case as an opportunity to revise those. I will be giving you at least the definition of those injuries, which of course I'm going to elaborate in the classes when we are going to discuss the pediatric files, and I'm going to explain all the injuries in details. But we will utilize this chapter as a medium to just maybe hint you at the definitions. I'll just give you a review over what sign and symptoms would indicate what definition or how you would categorize it, what kind of injury that would it be. So we'll briefly talk about the types of injuries, and more we will be focusing on the child abuse. And whenever you suspect it or whenever you're concerned that there is child abuse, what should be your approach? What should be your protocol that you need to follow? And remember, in ADC, always remember protocols. Always remember your line of treatment or your line of approach. If whenever there is any condition, paper 1, 2, 3, 4, irrespective of whatever branch you get the question about or whatever problem there is always a protocol. When you consider dentistry as protocol, it is helpful because in the exam, whatever happens, if you have a protocol in the mind and you look at a particular scenario, immediately that protocol comes to your mind and you know what I have to follow. And in the exam, if they give you a certain step and they ask you about the next step, then if you knew the exact line of treatment or how you have to proceed, then you can easily answer based on what step ADC has given you the information and what next step you would follow. Does that make sense? You all have seen SBQs now. You all have actually seen that history can sometimes give you a part of information and then they ask you the next step. When they ask you the next step, the best way to crack this is to always know protocol. So here we learn the protocol for child abuse. So let's start with the case. Skateboarding accident, 6-year-old boy, of course with mixed dentition then, with a facial injury attempts late one afternoon without an appointment, assess the child and decide what treatment he needs. So this is the clinical presentation. The patient's face, you can see the bruises on the nose, on the upper lip, which appears bruised and slightly lacerated. There is a scab tissue being formed. Now the child complains of loose front teeth and that his mouth is sore and it also hurts to eat. The child's mother says that he fell off his skateboard, banged his teeth. Injury occurred the previous evening when he was staying at a friend's house. Family attends your practice occasionally. Patient had some primary molars extracted under the GA 6 months ago, and since then he has missed 2 appointments for his review. The patient is otherwise fit and well. Now, what do you need to know about the accident? The further details, like the exact timing, whether it was witnessed by others, and who was responsible for looking after him at that time, should be sought. Was he knocked out when he fell? What type of surface he fell on? Were the abrasions or mouth contaminated with soil or other dirty material? And what is his tetanus immunization? These questions go in general with any situation of injuries. Any child who comes with injury, these questions should always be asked related to the accident. Then the child looks anxious and withdrawn. Abrasions are present on the tip of the nose and upper lip. These have a parallel vertical pattern which is consistent with a scraping on a pavement but are not visibly contaminated by debris. When asked if he has injuries elsewhere, he does not respond at first and then shows abrasions on his knees and elbows as well. On examination, his face, you notice that faint parallel lines of petechial bruising is running horizontally across the left side of the neck, and there's bruising on both the outer and the inner surfaces of the right ear. No other injuries are visible on those parts of his arms and legs which are not covered by clothing. So look at the pictures here for the neck and ear. This is the left side of the neck with bruising, which is also kind of like correlating with the finger imprint. Then the patient's right ear, which also shows a sign of internal bleeding or petechia form or bruising, internal bruising. Upon intraoral examination, the patient's upper anterior teeth and lip are shown in picture 36.4. So you see there is the torn frenum, the lip is lacerated. This left central is palatally displaced. Right central does not appear displaced from its position, but there is slight bleeding in the gingival sulcus. So these are your extraoral and intraoral findings. He's in an early mixed dentition at the age of 6. He has poor oral hygiene, no obvious caries. There are abrasions on the vermilion border on the inner surface of the lip. The upper labial frenum is also torn and bruised. The upper left primary central incisor is bleeding around the gingival margin and is displaced palatally. On examination of the patient, you find that both upper primary centrals, they are slightly mobile and tender to percussion. Displaced incisor is not causing occlusal interference. Now let's see what you can derive out of these signs and symptoms. So tenderness on percussion is a great sign for a periapical status. If an endodontically tooth is involved and you get tenderness on percussion, you would link it up with periapical periodontitis, apical abscess, like that, apical involvement with the pathology. But that's when your endodontic involvement of tooth is seen. Tooth is carious or the pulp is involved. But also periodontal and periapical involvement can happen when it's an acute trauma, like this particular case, injury. Then also there is pedial damage. So that doesn't mean that it's a periapical abscess or the pulp is non-vital because it's tended to percussion. That indicates that currently the pedial is inflamed and pedial is showing signs and symptoms. Right? So there is pedial trauma. And then now just giving you a brief introduction on the categorization of injuries. The most basic is concussion. And then there is your subluxation. Then comes your lateral luxation. So concussion is your injury where when the trauma occurred, but it led to pain in the pedial area, it damaged the pedial area, there would be tenderness and percussion, right? There might be some bleeding in the gingival margin, but there would be no mobility and there would be no displacement, right? There would be no mobility, no displacement. It can still hurt on percussion or biting. That's your concussion. No mobility and no displacement. That's your concussion. Subluxation means there is mobility, but there is no displacement. So mobility is present, displacement is not. That's your subluxation. Then comes your luxative injuries. Luxative injuries means there is mobility and there is displacement, both. Now, because there is displacement, based on where they got displaced, it could be your lateral luxation if it went labially or palatally displaced, right? It could be your extrusion if it got displaced externally out of the socket. It could be your intrusion, which would mean that it has been intruded in the socket, or it could be complete avulsion there, where there is complete displacement out of the socket. So these are your luxative injuries, which is lateral luxation, extrusion, and intrusion. Then is your final, which is avulsion, the most basic concussion, and then your subluxation. Based on the criteria of mobility and displacement, can I assume that it makes sense for everyone, and that simplifies the categorization of injuries for you? Then there are multiple injuries, other injuries like fractures, which would involve crown fractures, which would be your root fractures. And when I discuss the pedophiles, of course, I'm going to elaborate all on it, and we're going to learn the management of each and every trauma. So even if now it overwhelms you that there's so much in injuries, there's so much in trauma, trust me when I say that when we discuss those files, when we discuss each and every trauma case, you would be a pro in just reading a history, knowing and identifying what kind of injury it is, and identifying what is the perfect management for that. That's how trained you're going to be in managing the injuries. From these two lines, I gave you a simple review of basic lesions, basic injuries, and its categories. Now it is so easy for you to classify it, and let's see. Upper primary central, which is your slightly mobile attendant to percussion, and displaced one is left. So if left one is displaced palatally and mobile, that would be your lateral luxation because it's mobile and displaced. The right one is only mobile and not displaced, so it is subluxated, right? Easy to categorize this one. Yeah, let's move ahead. So you should already be suspicious about some aspects of his history. What information would you ask? Now, whether he has already received any medical attention and why dental care was not sought after immediately after the injury, who was looking after the child when he was injured, why did not present him to the hospital or dentist. You should ask that the child himself about the cause of the injury, particularly allowing him to talk and volunteer information without asking leading questions. When you ask the patient what happened to him, he looks away and says nothing. When you note the marks on the neck and the ear, the mother also looks uncomfortable and says he fell off a wall last week, he's very accident prone. So those things actually raise your concern, especially the neck marks and the ear marks are raising your concern about abuse. Now, what investigations would you perform for the direct dental injuries? First, you address the chief complaint. What radiographs would you take? So a periapical view of a primary incisor should be taken to show the extent of physiological root resorption, any displacement or root fracture at the proximity of developing permanent incisors, as well as aiding the diagnosis. The radiograph will act as a baseline for future monitoring. If a periapical film is too uncomfortable, then you can take an occlusion or an extraoral view as well. Now, what does the radiograph show you about whenever there is an intrusive injury or a lateral luxation? So whenever there is an intrusive injury or a lateral luxation, there is a risk that the primary tooth can impinge on the permanent tooth part. And how you can be assured that it's not happening is when you take a radiograph. So if your primary tooth, it appears shorter. If it appears foreshortened compared to the adjacent tooth, if the tooth which has been intruded or displaced appears shortened, that means that the tooth root has been pushed buccally or labially and the tooth crown has been intruded palatally, right? So whenever the crown appears short on the radiograph, it means that the root has been pushed buccally. And whenever on the radiograph, the complete tooth appears elongated, not all of them, just this particular injured tooth appears elongated compared to the rest of the teeth, adjacent tooth. In that case, that means that the root has been pushed palatally. Please remember this. If at all in exam you get a radiograph of an injured lateral luxation or intrusion tooth and they say that it appears shortened or they say it appears elongated compared to the adjacent tooth, then elongated would be when the root has been pushed palatally and shortened would be when the root has been deviated buccally. So because the permanent tooth bud always is present apically and palatally to the root, if it appears short, that means the root has come buccally, that means it is at less risk of impinging the permanent tooth bud and you can leave it as is. There's no need to extract it. Right? It may have some potential to re-erupt or it could just exfoliate. But if the tooth appears long, that means the root has been pushed palatally, the tooth bud is present palatally, it can impinge on the permanent tooth bud, so extract in this case. I hope it resolves and it clarifies the shortening and long appearance on the radiograph and how and why radiographs are important, especially after the displaced injuries or luxative injuries, right? So what do you see upon radiograph? All permanent incisors are present, appear to be relatively distant from the primary tooth too. There is resorption of the incisors consistent with the patient's age. And there is increased pedial space and displacement of the upper left primary central incisor also, but no other abnormalities. So left incisor appears slightly displaced, pedial has been widened because obviously there is luxation, so there would be some rupture in the pedial ligaments and that's why it is appearing widened, but it is not impinging the tooth bud and the occlusal views clearly shows that. That's why there is no risk of damaging the permanent tooth bud, so there is no requirement of extraction. Central incisor and lateral luxation of the upper left primary central incisor. The findings are consistent with the history of accident fall from a skateboard, but are accompanied by bruises on the neck and ear, which give cause for concerns about possible physical abuse. So the dental injuries are correlating: subluxation because there was no displacement on the right, but mobility, and lateral luxation because there was both mobility and displacement. Easy to come to a diagnosis like that when you understand the features, when you understand the clinical presentation. It is so easy to diagnose. So that's how deeply you need to understand them. You look at it, somebody says the symptoms, and you're immediately able to come to the diagnosis. That's how efficient we are going to get with injuries. Okay, I'll be sharing the ADJ article about the endodontic management of traumatic injuries, and you start reading them. When we have your orientation class, when I start the endo classes, I'll teach you that as well. I'll tell you that you have to start reading the traumatic injuries article as well. Because there are so many SDQs on traumatic injuries, it definitely becomes your decisive factor that how well you will score in the exam. If this is your weak point, then you can actually lose the complete paper, right? So when you know there is a certain concept which gets asked very definitively, then it's your sole job to make it as strong as possible, right? Now, what factors in the history make you concerned that it may be also a case of child abuse or neglect? Now, the history is vague, does not fully explain the injuries observed, which is on the neck and ear. There was delay in seeking dental care without satisfactory explanation. There was possibly a lack of adult supervision also to ensure the child's safety. So then why does the history not explain the injuries? Now, there are injuries to soft tissues, not overlying bone prominences like the neck and the ear. Neck and the ear, they come in the safety triangle. If they also have injuries, then they do not correlate with the fall injuries. These are the injuries to both sides of the body, the left side of the neck, right side of the ear. If it was related to the fall, child would have fallen on one side. The pattern of bruising on the neck is suggestive of a slap mark. There are parallel lines of petechia, which indicates that it is finger impression, where the blood was forced out of the capillaries by the force of the slap. Then bruising of the inner and outer aspects of the pin of the ear suggests there has been pinching or pulling. The neck and ear are rarely injured in the falls because they lie in the triangle of safety, because the triangle of safety is between your shoulders and parietal area of the skull. So whenever somebody falls, either the skull, parietal area, or the shoulders, they bear the force of the trauma or the injury, and the neck and the ear, they are saved. So these are your areas, the shoulders or the parietal area of the skull, which take the most trauma from the injury. So you might have also a sense of unease about the boy's behavior and interaction with his mother. The patient seems unwilling to talk about the cause of the injury, so the behavior of the child is also indicated that he is suppressed. So how certain can you be that the injuries are not accidental? Care must always be exercised when interpreting injuries. It is important to realize that there are no specific injuries that are diagnostic of abuse, even though there are some patterns of injuries which can suggest it. Now, there will be almost always a certain degree of uncertainty, especially when the type of injuries are seen in a dental setting. In all such cases, you're likely to be weighing the evidence from a variety of sources and then must come to a judgment yourself. There are no easy answers, of course. A torn labial frenum earlier was used to be considered diagnostic of abuse, but now it has been recognized that it may also result from an accident. Now, in this case, which is also accompanied by other intraoral injuries, you are not suspecting it to be your abuse because obviously there are your knees bruises also, elbow bruises also, which is correlating with a skateboarding accident. However, but if there was a torn labial frenum with a child who's not yet walking, then he would not have had that fall if he was not being taken care of. So he's unlikely to have fallen by his own. That is a sign that he's not being taken care of, or there is a certain amount of neglect or abuse. So torn labial frenum in a grown-up child can be accompanying a fall, but if it was in a younger child or a toddler or a baby, then it indicates abuse, right? So please remember this factor, how the torn labial frenum in which age group would be indicated with abuse and which age group would be related with the trauma or fall, accidental fall. And what general risk factors for child abuse are recognized. So the risk factors are given in a table, which I'll just go to in a moment. And such features should be noted during the appointment. You should be able to identify them from the previous knowledge of the family or in your records. They may be helpful when deciding how to interpret your findings and in deciding what to do. So the risk factors are, there are parental factors, societal factors, and the child factors. The parental factors are when the parent needs additional support to meet the child's needs. That means they're very young parents, they're single parents, or they have difficulties in learning, mental health problems, drug and alcohol abuse. Societal problem would be they belong to a poor socioeconomic class, they are socially isolated, they're living in poor housing, or there is family violence. And children-related factors would be that it's a young baby and toddler, which are most vulnerable because they require the maximum attention. Then children with disabilities because they require additional help. Older children, particularly girls, are vulnerable to sexual abuse. Children with behavioral problems, children who are looked after in foster care or residential care. So these are your risk factors for child abuse. Now, what would be your treatment for this patient? First of all, for the problem at hand, which is your dental injuries, which is your subluxation and luxative injury, lateral luxation. So give analgesia as required, and the drug that would be given would be of your paracetamol suspension. Then you would recommend a soft diet. You would give instruction for oral hygiene using chlorhexidine gel, which is applied twice daily for a week. Advise the mother and the patient to return if there is increase in pain or swelling. Inform the parent of the possibility of damage to the developing permanent teeth and the need for follow-up. Make the first follow-up appointment after 1 week to see the soft tissue healing, the lip healing, the gingival healing around it, reduction in mobility, etc. Splinting the teeth is unnecessary, and it would also hinder the recommended oral hygiene procedures, right? If it was permanent tooth and mobile, then splinting would be required. If it's a primary tooth and mobility is not excessive, then splinting is unnecessary. So what else should be done? The injuries to the mouth were probably caused by a skateboard accident. They are consistent with this explanation and they are accompanied by elbow and knee injury as well. However, the unexplained injuries on the neck and ear, you need to decide what must be done about these additional injuries. It is often helpful to discuss the case with a suitable experienced colleague or advisor, such as a nurse or social worker, and also you have to safeguard the children from this abusive environment. Then you will have the flowchart is given, which we are going to discuss, and we'll learn the protocol, how to follow up with such cases. So what would you say to the child and the parent? Explain that you're concerned about the marks on the neck and ear and that you need to arrange for someone else to look into it, right? And ask for the consent to phone the children's services to share the information. If the parent questions whether that's really necessary, then you have to stand your ground and give further explanation. You should explain that your responsibility is not simply the health of the boy's teeth, but also his overall welfare and safety, and that you recognize that mother also would want that. Research shows that being open and honest from the starting results in a better outcome for children. So are there any circumstances where you would not even discuss with the parent and simply call the child protection? Well, yes. Usually it is considered good when you can talk to the parents and express your concerns, but there are certain exceptions where you would not even discuss with the parents. That would be when you think that further discussion might put the child at greater risk, where discussion would impede a police investigation or social work inquiry, where the sexual abuse by a family member is or organized multiple abuse is suspected, where fabricated or induced illness, which is formerly known as your Munchausen syndrome by proxy, is suspected, where parents or carers are being violent or abusive and discussion would place you or your staff at risk, when parents or carers are not present and it is not possible to contact them without causing undue delay in making the referral. So these are certain exceptions where you don't have to consult the parent and you can simply call the authorities. In these circumstances, first seek advice from your dental defense organization or from senior child protection professionals, then reasonable judgment must be made in each case. What would you do next? Well, then you would phone children's service to make a child protection referral. You will be asked to give the complete history of the child, the name, date of birth, address, gender, school, name of the person. Makes sense? All these things make sense that you have to provide. Then you have to discuss your concerns and agree on what will happen next. Agree with the social worker what you will tell the parent and child and what will happen next. So it would become a collaborative decision. But for your ADC exam, the most important point is first, what types of injuries should raise your concern and what should be your step when you have concern? What should be your stepwise protocol, right? So then anything else that you have to remember is you need to keep comprehensive contemporaneous records. That would include any explanation given by the parent and the child in their own words. You should include both a written description and the diagram of the injuries. Differences between fact and your opinion should be clearly stated. You should include a summary of the discussion with both the child and the parent. If other members of the dental team have been involved, they should also record their observations. What action is required later? So for ADC, the later actions are not asked. For ADC, as a general dentist, when they're judging you in the exam, they're only concerned with identifying whether you're able to identify the abuse or not. So how will you identify? You should know the risk factors. They can ask you about risk factors. They can ask you about the types of injuries. Is that correct? These are the two most important features which will help you in identifying that abuse is present, which is if the patient comes in the risk factors and the type of injuries indicate that, and the protocol that you followed also hints or makes you suspicious towards abuse. And then you have to report the authorities. They are not going to ask you what would be the authorities doing. That is beyond the scope of ADC. And that's why when you have concerns about a child's welfare, you would first assess the child. So first is examine the child, take history. When you take the history and then what you find on the examination, if you think it's correlating, then your suspicions will not arise. But your suspicions will arise, like in this particular case, the skateboarding injuries did not raise your suspicions, but the late presentation or the neck injuries or the ear injuries, which come in the safety triangle, that examination part is not correlating with the history, and that's why that raised your suspicions. And then you will ask the child about what was the cause of the injury, and you'll also ask the parent. And so history would be taken by child and parent both. And if that history does not match with the examination, then you will send the parents outside and then you will talk to the child. Let me again briefly give you this. You will take the history from both child and parent, and then you will examine the injuries. Of course, when they do not match, When they do not match, only then your suspicion will arise, because if that matches, then you're not suspicious anymore of abuse. If they do not match, then you go to the next point, which is talk to the child. You can do that in private as well. You can send the parents out so that the child can feel comfortable and give their own honest version. So I'm breaking down this box, and ADC is mostly concerned with these steps only. Because when you talk to the child and yes, your suspicions are confirmed, then you go on and call the authorities. That's this entire box. Okay? So this box I'm breaking down because ADC can ask you at any particular step. One is you're concerned about the child, you're concerned about child safety. What would you do first? Take history from the child and parent, correlate with the clinical presentation. It matches, it's fine. It does not match, then you send parents outside, you talk to the child, right? So this protocol needs to be followed. Please remember this widening and this explanation, elaboration that I've given you of this box. I will use this complete protocol to answer a lot of abuse questions in the files. Remember this one, okay? It is going to help you so much you can't imagine right now. So then again, you call and you follow up with the authorities, not ADC relevant. So now asking about, is the dental neglect abuse? So child abuse is defined in 4 categories, which is physical abuse, emotional abuse, sexual abuse, and neglect. Abuse or neglect, they may be by inflicting harm or by failing to prevent harm. Recently has been increased agreement that severe untreated dental disease can indicate neglect and should prompt a child protection referral. So United Nations Convention also indicated that children have right to attain the highest attainable standard of health and to facilities for the treatment of illness and rehab of health. To enjoy optimum oral health, children need parents to provide a suitable diet, facilities, and help for their oral hygiene and access to dental treatment when required. So there is no doubt that oral disease can have a significant impact on the child's general health. It can lead to severe pain, loss of sleep, poor growth, quality of life can also get affected. Once the dental problems have been explained to parents or carers, an appropriate and acceptable dental treatment has been offered to restore oral health, the following would be of concern. Repeated missed appointments, failure to complete the planned treatment, repeatedly returning in pain and requiring GA for dental extractions repeatedly, all this would be raising a concern regarding neglect. Preschool children are particularly vulnerable, and in such cases, it is recommended that you contact the child's health visitor to discuss how you might work together to support the family to ensure that the child's needs are met. This contributes to safeguarding children, namely not only protecting children from abuse and neglect, but also taking a wider range of measures to promote their health and development and to minimize risks of harm. In many cases, lack of knowledge and difficulty assessing the care account for the apparent neglect. However, if a child is suffering significant harm from untreated dental disease, then it will be necessary to even make a child protection referral without delay. Right? So that's your basic hint about neglect. So you can see these are the important markers of neglect. But mostly for ADC, whatever the questions are being asked, whatever is the most prominently important, that is the abuse. And what is your conduct for abuse? That's what the ADC is repeatedly giving questions at. There are not multiple questions of abuse. There might be 1 or 2 because there are, as I said, injuries are very favorite. So if injuries get asked, there would be concerns, there would be questions about your information, your knowledge, and your acumen regarding managing child abuse. And this is what you need to be really, really solid on. You should be really prepared on. Anybody asks you a child abuse related question, and you should know what is the protocol that you're going to follow. If you remember all this, there's nothing that can stop you from answering a correct child abuse question, and traumatic injuries will be taken care of. I will be teaching you the in-depth explanation of each injury, the management, the treatment plan, everything will be taken care of. Child abuse, you learn the steps that I've explained to you, and you're sorted, you're good to go in exam. All right, so that would be end of case number 26. Thank you so much.